Hello and welcome to Java Talk. My name is Bryce Couch and we're here at the University of Sioux Falls. With us today is the University of Sioux Falls President, Dr. Bradfield. Dr. Bradfield, thank you for joining us.
Thank you for inviting me.
Needless to say, we're in very unique circumstances globally, let alone in the state of South Dakota, let alone on campus. So I kind of want to talk to you today about the steps that you've taken and the things that you have done to sort of prepare the university to come back to school.
Yeah.
So the first question I'd like to ask is, how do you think the fall semester is going in general? I know you've been planning since, spring break essentially when we had to go online. So overall, how do you think the fall semester has been?
I feel very good about the progress we've made. I feel good about the safety measures we've put in place. It's been a learning process along the way, and we had one of those learning moments early in the semester when we saw a spike on campus of quarantine and isolation. But since then, that has been pulled in, very controllable. We understand what we're dealing with. Every morning, a team convenes that we call the COVID response team. And we talk about the daily cases. We talk about issues associated with those cases. And I would remark also for our students, we've really been pleased at the reaction of our students. We know this is really inconvenient. None of us like wearing masks. None of us like the isolation. But we've been really, really pleased with that. And it's demonstrated it's working in our numbers. And the same would be for our faculty and staff. So right now, as a general statement, we're really pleased with what's happening.
Absolutely. You mentioned the students, and as a student myself, I really want to be on campus for as long as I can. So what measures are you taking to prevent the safety information to students and staff alike on campus?
Yeah, I would say that has been, Bryce, probably the most labor-intensive part of our work. I have written, I've joked that I've written probably 3 dissertations in the last couple months. We have sent continual communications out to students, to parents. We've tried to measure that a little bit because sometimes you can over-communicate to the point where people stop reading it. We've posted it in public venues like our COVID spot on the web. That is a public dashboard now so anyone could look at that. We're not trying to hide anything. And part of the reason we've taken the very open approach that we have is that we care deeply, of course, about our campus community here, our students, our faculty and staff. But we also have an obligation to the external community that supports us, and that's important to public health. I mean, as you know, colleges right now are being called out in the media a lot because of the spread on the campuses and then how that trickles out into the external environment. One thing that you'll find very interesting at the University of Sioux Falls, and this is something we trace in our numbers very closely, as far as we know in our contact tracing, the cases that have come to campus are primarily coming from the outside in, not the inside out. You may say, well, what does that mean? It means that when a student has went home, for example, for a weekend, and perhaps someone in their family has it or a close friend and they were in contact with them, that has been a lot of our caseload right now as far as quarantining has been, and a few of our actual cases where we had to put people in isolation. So I don't mean to make that sound like it's a great thing, but it's a good thing for us to kind of understand that we do have containment. And from the day we started this process, and I had several meetings with medical professionals here in the city and the South Dakota Public Health Department, they told us in no uncertain terms what they hoped from us was that we would really work on containment. One of the doctors made an interesting Midwest analogy. He said, Dr. Bradfield, very politely to me, he said, your job is to make sure that the garbage fire doesn't coalesce into a prairie fire.
Yeah.
And we took that to heart, and that's what we've been trying to manage here.
So as far as the safety guidelines go and just being on campus in general, did you seek input from the staff and the faculty as far as their comfort level and their ideas on the situation?
Yeah, we tried to make this a collective university effort. I mean, to some degree, I don't want to overstate that either, because much of what was happening was during the summer when we were socially isolated for a variety of reasons. But we tried to make sure that we took into account all of the things that were critical. The one area I would go to that was most relevant for students was the whole idea of what kind of college experience am I returning to? If I'm going to just go live in a residence hall and sit in my room all day and do online education, we kept talking about how we bring some sense of normalcy as best could be achieved amidst the pandemic. And so we worked very hard on 4 learning modalities, trying to make sure about 66% of our classes had some sort of on-ground component to it, trying to make sure that students did have the opportunity to socialize in food service and other places, but yet be able to do effective contact tracing, so when something did emerge, we were able to immediately address it. And that required a lot of planning in our residence halls too, because we had to consider the contingency of, well, what if we do have an outbreak? And we have students that are not local, they're perhaps from 500 miles away. It's our job to take care of them. So that took us to an agreement with Avera Health, who are our partners for athletics, and we signed an agreement, a contract with them to ensure that if someone got sick, that they were not isolated. We could monitor their oxygen and have medical professionals checking in with them. So it's been, as I said prior to our start of our interview here, we could talk a long time about the safety measures. Yeah. Right now, as we're speaking, the final pieces are being put together that you may not even know about. We are putting bipolar ionization units in all of our buildings. This is a technology, it's been around for a few years, it's on many government buildings, but on the air handlers, it's a device that allows us to release ions into the air that will kind of latch on to airborne particles, including virus and bacteria, and render them inactive at an over 99% rate. So it contributes greatly to air quality. It's not foolproof, but it's just another safety measure that we felt was important for our students and our staff and faculty here at the university.
Absolutely.
Yeah.
And so my last question, and I know that with all the uncertainty, it's almost a day-to-day, week-to-week at the very biggest scope, but do you kind of have any insight as far as what the spring semester is going to look like?
Yeah, it's a great question, Bryce, and one that I know not only our students, but our faculty and staff have great interest in. We've been engaged in that conversation, especially in the last 2 weeks. I needed to see how some things were going with certain kinds of peripheral activities that are part of our university. For example, athletics. Athletics, as most of us know, were canceled for the fall. There is some talk, there could be some sports that have a limited season in the spring. We just had our Northern Sun Board of Directors meeting on Monday, and we had this very conversation. It brings into question the calendar. Do we go off, do we send people off to a long spring break where they may go to areas where there's high infection rates and then come back to campus that would perhaps create some havoc here, the kind of havoc we don't want. So we're looking at the calendar, our learning modalities. We've learned a few things about that, how we can help our students, how we can help our faculty. It's been very labor intensive for everyone, but I'd also tell you that because of everyone's belief in our mission here at USF and an absolute passion for our students, it's been a labor of love too. So.
Absolutely.
Yeah.
Well, that's all the time that we have today with Dr. Bradfield. I know you're a very busy man. I really appreciate you coming down and talking to us.
Yeah, no, I appreciate the invitation. Thank you very much.
Thank you.
Yep.